The latest research on that affordable diabetes drug is pretty fascinating. Turns out, it's not just about controlling blood sugar, but it might also reduce cancer risk and, get this, even extend life in older women. They studied metformin among women over 60 with newly diagnosed type 2 diabetes and discovered that using metformin reduced the risk of dying before 90 by about 30%.
Right, that's impressive. And there's also evidence from another large study with thousands of patients suggesting that metformin cuts down skin cancer risks, like a 54 to 55% reduction in certain skin cancers.
Yep, exactly. It's like metformin is working on multiple fronts. It not only modulates glucose levels, but also influences cellular metabolism and reduces inflammation and DNA damage.
Yeah, But you know, one thing that puzzles me is, don't you think it's a bit early to call it a miracle geroprotector? I mean, the study only involved women with diabetes over 60.
True, that's a fair challenge. Absolutely, there are definitely limitations. The benefits in terms of longevity, for instance, might not extend to men or even younger individuals. The data on dosing and HbA1c were not fully conclusive either.
Right. And then there's the upcoming TAME study in the US, aiming to involve nearly 3,000 participants aged 65-79 to see if it can delay aging in non-diabetics.
Yeah, that's the next critical step. The concept is really intriguing, using a drug, which for years was just prescribed for diabetes, as a kind of anti-aging medication. Its mechanism might be, it's like reducing chronic inflammation and cellular damage over time.
Definitely. It reminds me how sometimes ordinary solutions can have extraordinary side benefits. But we also have to remember, as the expert noted in the study, that nothing replaces a balanced diet and regular exercise.
Right, that's absolutely key. Exactly. The study emphasizes that metformin could be a game changer for diabetic women, yet it clearly points out that a healthy lifestyle remains essential. And this serves as a reminder that medications, even repurposed ones, need to be taken in context.
Also, you'll notice that the dissemination of this result was wrapped up in a lengthy privacy and consent notice about data tracking by the site. Kind of ironic, right?
Yeah, it's like a digital age disclaimer that reminds us dealing with data is as critical as the study itself. Right, the privacy policy portion was detailed, discussing tracking cookies and data sharing, which shows that even when reading health news, your data might be under the microscope.
Oh, for sure, So overall, while metformin's potential in extending life and lowering cancer risk is exciting, we need more research across a broader population before making any sweeping conclusions.
Yeah, exactly. And that's our takeaway, promising early data, but always balance it with the broader picture of healthy living and cautious interpretation of research findings.
Absolutely. Thanks for the engaging discussion. It's clear that sometimes a simple, affordable drug can have, surprisingly multidimensional benefits.
Definitely always something new to learn.